time they try to move, it hurts more. I was going to go into some positioning, some exercises or activities that you could do to help get you out of pain or help alleviate some of the pain so that we can get into some strengthening and stretching. However, given the little snafu that we had there, we're going to go right in. We're going to skip that. I'm going to see if I can videotape something. I'm going to put a video together and get that over to you guys at a later date. But right now, what I want to go through with is the important part, which is some of the exercises that you guys can incorporate right now to start helping yourself build up muscles, keep your muscles strong, and also to maybe even help with some of the pain that you guys may be having at this point, okay? I see some of you guys standing, and some of you guys, that's probably the case that you guys can't sit or you guys are not comfortable sitting. So we're gonna go ahead and start. When we talk about stabilization of the lower back and the hips, we have to talk about the abdominals. That's kind of the key here. And the abdominals, we're going to talk about 3 areas of your body. The front are your abdominals, the side are your gluteals, your side gluteals, and in the back you have your glute max, which are your big gluteal muscles, your sit muscles, essentially the muscles that you sit on. Okay, so if you guys want to follow along, if you guys want to position yourself on your back or on your bed, hopefully angle the camera so that you guys can see me. We can kind of go through this together. I'll give you guys just a few moments to get you guys in position. It's recording. Stop recording. Yep. Okay. So let's talk about the abdominals first. Okay, we're going to talk about the front muscles that we talked about. And the abdominals, there's 2 different sets. You got your internal abdominals and your external abdominals, your inner unit and your outer unit. The important ones for us as physical therapists initially is your inner unit muscles. And these are your deep abdominal muscles, your transverse abdominis, your multifidi, your inner transversarii, your spinalis muscles. Deep, these muscles attach on your spinal column and they create stability. They don't move a lot and they're small. They don't create a lot of movement, but they create a lot of stability to help protect your spine. And this is important for people who have low back pain or even hip pain to make sure that we know how to activate this. And because these muscles are so deep that they're respiratory muscles, they're very much in line with your lungs and they help you breathe. So the first thing we do is we start to do some what we call diaphragmatic breathing. If you can see, my hand is here on Amanda's belly button, and I'm going to have her breathe into my hand so that when she breathes, only her stomach or her belly button is going to rise into my hand. And you're going to see my hand rise as she inhales. And then as she exhales, the stomach is going to drop down. Okay, so we're going to do that a couple times. Inhale and exhale. I'm going to put her phone here and see if you guys can see the phone. Inhale and exhale. Now what Amanda's doing is she's using her chest more than I would like to see. We only really want to have you use your stomach. So what I'm going to have Amanda do is put one hand on her chest and then try not to let your hand move at all. So it's giving you some feedback. And then you can put your other hand on your stomach or right over your belly button. And in this case, I have the phone there. So she's inhaling, so the phone goes up, and then she's exhaling. Good. Inhale and exhale. And that phone should go up toward the ceiling on the inhale, or your hand should go up toward the ceiling on the inhale and down toward the floor or toward your spine on the exhale. And when you get really good at it, you will feel on the exhale as the stomach drops or as your hand drops, you will feel those muscles deep within your abdomen. Again, your transverse abdominis really activating. And those are really, really important muscles to have. Okay, so make sure nobody falls asleep here, okay, because you guys are all on your back, probably relaxed. And this is a much harder exercise than people think. And in people with low back pain, this particular muscle, your transverse abdominis, kind of goes dormant and it just is not working well. Okay, so I want you guys to practice this. And again, this video will be posted online so you guys can review it. Okay, so inhale and exhale, the stomach and the muscles engage in your abdominals. One more time, inhale and exhale as they engage. Good. So now she's getting a pretty good amount of excursion through that stomach and through the phone. So now I know that she's activating those muscles, especially on the exhalation. So now, Amanda, I want you to pull in and draw in that belly button. You guys may have heard that term, draw in or scoop and pull in those abdominals so that you feel the engagement. And now just continue to breathe. People feel that when I tell them to scoop or draw in, they feel that I'm telling them to suck it in. Not really, because when you suck it in, you stop breathing. And when you stop breathing, you're going to turn blue in the face, okay? And then your abdominals are not going to work at all. So keep pulling in and hold. Good. Now, she's got a pretty good amount of control there. She's breathing. The abdominals are staying in, and I can actually feel those abdominals engaging right on the side of her belly button and out toward the side, toward her hip and pelvic bones, okay? Those muscles are active and tight. And I'm going to have her maintain that. Okay, so the next step, level 2, that was level 1. Level 2 would be to challenge her ability to keep that belly button in. Okay, so with this, I'm going to go from the back so I can cue her from the back. Amanda, now what I want you to do is keep the belly button in. I'm going to move this pillow from here. And I want you to maintain the belly button in and keep the pelvis perfectly still. And go ahead and lift your left leg up into a march position. Okay, again, without that pelvis moving. She did a nice job of lifting that leg, keeping that belly button in, and not allowing her pelvis to move. Now bring this leg back down, Amanda. Good. Now bring the right leg up. A little bit of a shift there. If you guys are watching on the camera there, she shifted as her right leg came up off the ground. Again, that's a lack of strength, a lack of activity. So we want to make sure as we're progressing through this march activity that pelvis is not shifting. Let's go again. Let's switch. Bring the right leg down, Amanda. And now let's lift the left leg. Again, we're seeing some shifting going on. It's hard to see it with the camera angle, but it's occurring. So there we go. That was a little bit better. So now she's really pulling in and there's no shift happening at all. And what you guys can do at home is put your hands on your pelvic bones and make sure that you feel when you lift one leg up that you're not getting any shifting going through your pelvis and that your belly button is staying in nice and tight so that you can feel those abdominal muscles engaging, okay? If you feel like this is too easy, you're probably not holding the abdominals in or you're probably not activated yet. Meaning that you probably need to go back and work on the diaphragmatic breathing to learn where and how those muscles should be active. So you should be feeling something happening. And everybody's at different levels, so some people this may be too easy. Others, you guys may not be feeling anything, like it's just nothing is happening. In those cases, it just may be that you're not activating well enough through your abdominals. And you want to go between 10 and 15. This is number 9 for Amanda. We're going to do a couple more, maybe get to 12. Initially, when I give an exercise, I start with about 10 to 12 repetitions, and we work our way up to about 15 to 18. Okay, make this one your last one, Amanda, and take a break. Okay, so that's level 2. So Amanda's doing great. She is getting this. She's activating well. She's keeping her pelvis still. We're going to progress her to level 3, and this is where we're going to leave off today with this particular series. We're going to lift, again, pull that belly button. In fact, let's do a primer first. Amanda, go and get through your diaphragmatic breathing. Inhale, the hand goes up. Exhale, the hand goes down. And as she exhales, I want you to try to almost force that air out. And when you force that air out of your tongue, out of your mouth with pursed lips, you're going to feel engagement of those abdominal muscles deep within your abdomen. Again, your transverse abdominis, really force that air out. I want to, if you guys have ever done Pilates, you hear them breathing, shh, 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 shh. And they're doing that because they're really trying to drive that air out to really get those muscles deep within their abdomen engaged. Okay, so if you need to do the shh, shh, that's fine. If you cough or if you laugh, you're going to feel those deep abdominals engaging. Okay, so now that's the primer. Let's go to level 3 of the marching series. So next, you're going to keep that belly button in, hands on your pelvis so you can feel the pelvis hopefully not moving. Bring the left leg up first to a 90-90 position into march here again. Hold that here, Amanda, and now bring this, keeping the left leg right where it is, bring the second leg up and hold it. Amanda, we saw a little bit of excursion of her trunk. Her belly button kind of popped up a little bit, and that's what we don't want to see. Amanda may not be ready for this exercise, but we're going to go with it anyways, just as a demonstration. Bring the left leg down, and now bring the right leg down. Very nice. Now bring the right leg up, and we're going to alternate. Now the right leg's going to go up first. Belly button in, pelvis is pretty steady. Now bring the left leg up. That was better. And she did better on that side. Maybe the right side is actually stronger than her left. And we're going to see that a lot of asymmetries. And asymmetries are not good. We try to correct those pretty quickly. Let's go left leg up first. hold it, and now bring the right leg up. Now she's getting, you guys are learning as you go. So the leg that comes up first goes down first. Right leg comes up, hold it. Now the left leg came up, and she's doing a lot better now. Right leg goes down, left leg goes down. Left leg comes up, so she's alternating. Good. Now the right leg comes up, left leg goes down, right leg goes down. One more. Right leg goes up, left leg goes up, right leg goes down, and left. Let's keep going, actually. If you guys are doing it at home, you guys are getting a little bit of a workout here. Right down, left up, hold, right up, and keep going. Like 3 more on each side. Right leg up, keep that belly button in. I'm gonna peek at the camera and see if I can see any pelvis is moving. Try to hold it at the top for at least 3 seconds, okay? And make sure that belly button is staying in, guys. Not bad, Ellen. You're doing pretty well, actually, there, Ellen Turner. Adriana, make sure that your knees are at about a 90 degrees, okay? So when you get to the top, it's 90 degrees. I'm just commenting on people that I can see their pelvis or pelvi. Jackie, not too bad. Bring the one leg up first. Hold it. Now maintain the belly button in and bring the second leg up. There's a lot of shifting going on there that I can see, so make sure the pelvis stays perfectly steady and level, no movement at all. And one more, let's see. Wendy, you're doing pretty well. I can barely see the top of your pelvis, but not too bad. You guys should feel this really working if you're keeping that belly button in and the pelvis and the spine stable, okay? And that's at least 12. So I'm gonna have you guys stop, take a little break, take a breather. If you do this correctly, and if you're engaging correctly, you will be sore here. I've had many patients come back the second day and say, wow, that was a really hard exercise, a harder exercise than I thought. They thought it was really easy, but if you're engaging properly and you're giving yourself enough repetitions, you will feel that really engage and those muscles will start to build. Again, we're creating building blocks, guys, because from here it gets much harder, but we don't progress you unless you mastered these levels into some of the harder exercises, the planks, some of the squats, lunges, and other exercises that we'll be doing in parts 3 and 4 of our series here together, okay? So I want to make sure you guys master this before we move on to more difficult exercises, because if you guys don't get this, the other exercises that we do are, you're just not going to get what we need to out of it. You're going to go blow right by them, okay? All right, so now let's work on the back, the gluteal muscles, okay? And specifically the glute max, okay? If you guys are going to be in the same position, if you guys want to watch for a little bit before you guys get down onto your backs, I'm gonna have Amanda squeeze her glutes together, okay? And then let it go. And my hands are on her glutes. I've known Amanda for a long time, so she doesn't mind, and I'm her physical therapist right now. So squeeze, and good. And I know she's doing a good job squeezing and activating those muscles because I see her pelvis. If you guys can see, her pelvis is rotating back and her back is flattening, okay? So if you guys are doing this yourself, what I want you guys to notice is when you squeeze your glutes together and you pinch them together, your pelvis should rotate backwards toward your chest and your back should flatten out, okay? And good. So the analogy I give people, because sometimes people, believe it or not, cannot do this. They have no idea where their glute maxes or some of their gluteal muscles are. And when I have them contract, nothing happens. They think they're doing it, but nothing moves or nothing no muscles contract. So the analogy that I give people is you have, when you want to get a diamond and you have a piece of coal, what do you need to get a diamond out of a piece of coal? You need pressure, right? You're going to have a coal in between your cheeks and you're going to create enough pressure to eventually get a diamond out of that. Okay, so squeeze your cheeks, squeeze that coal, and then hold. If you're holding long enough, hard enough, enough pressure, eventually you're going to get a diamond. And pelvis is going to rotate, and your back is going to flatten. I'm sorry for the cheesy analogies, but sometimes that hits home for some people. Hopefully it does for you. And let it go. Good. Now let's work on endurance. Let's work on squeezing your glutes. Again, Amanda's pelvis shifts back and her back flattens. And that's what we want to see. And she's already at step number 2, which is a posterior pelvic tilt, which is level 2 for this particular exercise. Level 1 is to squeeze the glutes. Level 2 is to create that tilting backward of her pelvis in order to get full engagement of her gluteal muscles. Okay? So if I can see somebody's glutes, let's see if we get a good amount of activation there. Let's go ahead and see it, Wendy. Squeeze those glutes. Okay, good. I see that pelvis rotating. Jackie, good. Squeeze, good. You got a good amount of rotation there. Let it go, Jackie. Good. And then Adrian, let's see what you got. Okay, good. Adrian, you're almost to the next level, which we're going to go to in a second, which is actually bridging. Ellen, let me see you. Go ahead. So don't lift purposefully, guys. The rotation occurs because you squeeze your pelvis or your glute max, and that pelvis rotates back. Charlotte, can you tip your camera down a little bit so I can see your pelvis? Perfect. Now let's see it. Very nice. That's good. I can tell you were a student of mine at one time, Charlotte. That looks good. And one more, Larry, or I'm sorry, Ellen, right? And good, perfect. Okay, now let's take the next level, level 3 on this one. Level 3, we're actually going to squeeze. The pelvis is going to rotate back. And now Amanda is going to lift her pelvis off the ground, no higher than her bra line, okay? And she's going to hold that there. And we're going to hold initially for 5 seconds. Still squeezing the glutes. Still, and you can kind of stack what we did on the previous exercise. She's pulling her belly button in and engaging her abdominals. That way she's getting global activation of her abdominals and her glutes. And that's more than 5 seconds, so we're going to come back down. Again, belly button pulls in and squeeze the glutes. The pelvis rotates, and then she starts to lift. If this is creating pain in anybody's back, when you lift, try squeezing your glutes a little harder. Try pulling in that belly button a little bit more vigorously and see if that takes away the pain, and sometimes it can. If the pain is getting worse, you're not able to take it away, I want you to go ahead and stop. Okay? Squeeze the glutes again and lift. Hold it at the top for 10 seconds. Keep squeezing. Now, the other cue that I give people is when they're up in this lifted position, they're going to create a magnetic pull between the back of the heels and the gluteals and the back of the heel. In other words, her back of the heels and her glutes are pulling toward each other, okay? They're pulling toward each other. If my right elbow is her glutes and my left elbow is her heels, they're pulling toward each other, okay? And what that's doing is creating more activity in her glutes, in her hamstring, and in her back muscles. And it's giving you a more powerful contraction to, again, build more strength, build more power, okay? So again, squeeze, rotate, and lift, and hold. Now, Amanda, create that magnetic pull between the back of your heels and the glutes in the back of the heel, and hold it. Now, let's hold this one for 10 seconds. 1, 2, 6, 7, 8, 9, and 10, and then come back down. Good. I'm going to throw in one more bit of detail, okay? So let's, again, squeeze again. The pelvis rotates back, and then she creates a lift. She's creating that magnetic pull between her heels and the glutes. And now what I'm going to have her do is, Amanda, you're going to hold this here for 10 seconds, and let me just see if anybody's good. Charlotte, that looks really good. Let's see it, Adrian. Squeeze and lift, creating that magnetic pull between the back of the heels and the glutes in the back of the heel. Good, Wendy, that looks really stable. Judy, I can't quite see your pelvis there. Ellen, that looks good. Now, I want you guys to come down, and what I'm going to tell Amanda is try to come down one vertebra at a time. So she's almost rolling down. This is kind of a next level of trying to control your abdominals to create a curling motion in between your vertebrae. And what that's going to do, it's further strengthen segmentally each level of your spine. There's a lot of little muscles in between there, and you are strengthening them segmentally here now by rolling down one vertebra at a time. Okay? And let's do one more before we wrap it up today. Squeeze the glutes, lift up, hold it for 10 seconds, creating that magnetic pull between the back of her heels and the gluteals, and the gluteals in the back of her heels, and she's holding. And now that's 10 seconds. And now Amanda, roll it back down one vertebra at a time, feeling those individual segmental muscles of her spine working, okay? Once you guys are all done with this, I want you guys to pull your knees to your chest just to give yourself a little bit of a stretch. Those muscles in your abdomen and your back and your glutes work a little bit right now. So we're just gonna stretch and kind of work, release them a little bit because they have been working pretty hard here. And just hold it for about 10 to 15 seconds. And good. Okay, that went by really fast. I did a lot of talking today. Next time we see each other next week, I won't do as much talking. I'm sorry about the little technical difficulty that we had there, but we are going to progress this to make it harder for you guys next time we see each other. These videos will be posted. I don't know when, but hopefully if it's this week, you guys can review some of this because I did a lot of talking, a lot of cues that you guys may not have remembered. You guys were all participating, so you guys didn't get a chance to write anything down. So watch the videos and see if you guys can pick up any other tidbits.